of the World Association for Sexual Health in 2024. I'm Dr. Elna Rudolph. I'm the president of WAS, and I'm from South Africa. Please let us know in the chat where you are joining us from all around the world. As a global confederation representing thousands of people who work in sexual health and rights professionally, we are honored to host this webinar with the Pleasure Project, the Case for Her, and Amplify Change. Our collective efforts in sexual health education, research, clinical services, policy making, and advocacy advance our vision of sexual health and rights for all. We live in a world where too many people don't have access to their right to informed and autonomous decisions. Only a handful of nations have strong laws and policies ensuring sexual health, rights, justice, and pleasure for all citizens. Sex-positive attitudes are far from universal, and diversity is often met with resistance and even persecution, as you will see in this webinar. Tragically, gender inequality and sexual violence persist worldwide, and in particular in zones of armed conflict and war. Despite the wealth of technological advancements, accessing comprehensive sexuality education grounded in scientific evidence, rights-based principles, and experience-informed insights remains challenging. Moreover, the absence of training and certification in sexual health, particularly in the Global South, highlights the need for leadership in sexual health and rights. We believe that a focus on pleasure can bridge many of these gaps, and in this webinar, we will show you why. I would like to introduce you to the Pleasure Declaration of the World Association for Sexual Health. If you haven't seen this document, it is beautiful. I'd love to have the time to read it to you as if it is a piece of erotic poetry, but we do not have the time for that today. So the link is shared in the chat. Please take a look at it if you haven't accessed it yet. So I would like to start with a poll. Michelle, if you could please share the first poll with us. So it says, are you convinced that pleasure is a portal to sexual health and rights for all? Yes, no, or I'm not sure, I'm here to learn. Please let us know what you think about that. So I'll just tell you where we've got Tanzania, London, South Africa, Finland, Uganda, Tunisia, France, Rwanda, Cameroon, Cape Town, Argentina, Mexico, London, the Netherlands, Uganda, Puerto Rico, Belgium, Liberia, Perth. Oh, I get goosebumps from head to toe reading out all of those countries. Thank you for joining us, really, from all around the world. We are also looking forward to taking your questions and gaining your insights. If you just have a random comment, you're welcome to pop it in the chat. If you have a question for our panelists afterwards, you can please put it into the Q&A. So I would just like to briefly show you our panelists. Oh, our results. First, our results. Yes. We've got a lot of pleasure activists here. Most people are convinced that pleasure is a portal to sexual health and rights for all. There are some who do not agree, and then there are some that are here to learn. But I'm sure all of us have something to learn here today. So I just briefly want to show you our panelists. If you can please quickly pop on screen, all of you. Let me see. There we've got Alexandra Lundqvist. I hope I got that almost right, from Stockholm. And then Philpott is in the UK. Beyonce is from Uganda, but currently having to be in the USA. Ingrid is from Rwanda. Katie is also in the UK. Renee is also joining us from South Africa. She's the executive director from WAS. And Rhiana is, oh, Rhiana, I'm sorry, I never actually got to find out where you are from. You can tell us.
Also from the UK.
Oh, also in the UK. Okay, we've got a big UK team here today. So thank you very much, ladies, for joining us. You will be introduced as time goes on. I will now introduce Anne to you guys. So Anne is a public health professional, pleasure propagandist and guerrilla girl of HIV prevention. She founded the Pleasure Project in 2004 in frustration of endless AIDS meetings where no one talked about people's motivations for having sex or even pretended sexually transmitted infections were airborne. The Pleasure Project builds bridges between the public health world and the pleasure world and develops evidence base for sex positive, pleasure based approaches to sexual health and rights. And it is a privilege for me to have you here. We work so closely together with the Pleasure Project being a member organization of WAS. So the floor is yours.
Thank you, Elna, and I'm delighted to be here with so many pleasure enthusiasts and colleagues and friends who have worked very closely on this partnership that you're going to learn more about today. And WAS and the Pleasure Project have been on a very long journey together and have been great partners in working to reduce the stigma in discussion of pleasure in sexual health and actually promoting and creating pleasure-based sexual health. I was on the Sexual Pleasure Task Force that wrote the WAS declaration and was delighted that for the first time, WAS as a global normative agency put out a declaration talking about the importance of sexual pleasure. And we know that discussing sexual pleasure is absolutely critical for our sexual health, but also, as has been said, it's a portal for conversations about our well-being. It's really important to have conversations about pleasure for those from more discriminated against sexual identities, because that's something which gets even more silenced and shamed. And critically, when it comes to consent and sexual rights, it's really important to ensure positive choices. As I say, how can we know what we want if we're only told what we shouldn't have or what we shouldn't do? So what I'm just going to tell you about now is this kind of trajectory, which has been really exciting. We've had the WAS Pleasure Declaration. After that, the Pleasure Project worked with the World Health Organization to create some evidence, a systematic review, which asked the question for the first time, does pleasure-inclusive sexual health lead to better sexual health outcomes? And we found that it significantly did. And this is the first time that this has been looked at, for example, since the beginning of the AIDS epidemic. But if we had done this in the early days, if we actually integrated pleasure into our messaging and into our sex education, we would have had more condom use, we would have had more lives saved. So this session is really important today, and WAS has been a great champion of this. But the other two organizations that are going to speak today have also been fantastic champions. The Case for Her has invested in pleasure when no other organization would, when the Pleasure Project couldn't get funding to do any of this work from anywhere, and they've been fantastic in funding this partnership. And then Amplify Change has been brilliant, and you're going to hear more about that, in integrating pleasure-based sexual health into their funding guidelines, into their work with partners. And we're going to hear from Beyonce and Ingrid about exactly what that means in a practical reality. We're also going to, after the evidence with the World Health Organization, we created something called the Pleasure Principles. And you just saw a video about the Pleasure Principles, which takes the evidence in the declaration and makes it real and makes it practical. So just to finish off, what we're going to talk about today is actually taking this vision of pleasure inclusive sexual health and making it real and really making it happen. And you've got the experts on this call who will tell you exactly what we learned through this process and how to do it yourself, what this means in reality. Thank you.
Thank you very much, Anne. So up next, we've got Alexandra Lundqvist from Stockholm, from the Case for Her, who will be telling us about their involvement in this project. Alexandra studied psychology at Menlo College before advancing into communications at one of Europe's prominent digital healthcare startup Scribe, leading their social media. Eventually, she became the communications and partnerships lead at the Case for Her, a blended finance investment portfolio addressing the key women's health issues of menstruation, female sexual health and pleasure, and abortion access. Thank you very much for joining us, Alexandra, and for the Case for Her, for your avid support of this course. I hand it over to you.
Thank you so much, Elna, and thank you, WAS, for organizing this convening so we can highlight this very exciting partnership. that we're going to see the results from today. So my name is Alexandra, and I'm the Communications and Partnerships at the Case for Her. So the Case for Her, we're a blended finance portfolio, and we address the key women's health issues of menstruation, sexual health and pleasure, and abortion access through grants, investments, convenings, and advocacy. And since 2021, when we introduced our sexual health and pleasure portfolio, we have been advocating strongly how critical it is to implement and openly accept pleasure into your work, and most importantly, your life. At the Case for Her, we embrace the concept of sex positivity. Sex should be seen as a positive, healthy, and natural aspect of human life, and people should be able to embody, explore, and learn about their sexuality and gender without judgment or shame. A pillar of sex positivity is that sex should be good, and all types of sex should be seen as good, so long as they are pleasurable and consensual for all involved. The Case for Her was extremely excited to facilitate this collaboration between Amplify Change and the Pleasure Project, since it provided a win-win opportunity for both generating data and implementing a pleasure-based approach in practice. As evidence shows, pleasure has been identified as a vital component for individual health and well-being, and as well as in comprehensive sex ed, but its inclusion is infrequent. To expand the evidence base on the effects of incorporating pleasure in sexual health interventions, the Pleasure Project, together with the WHO, supported by the Case for Her, conducted a systematic review of previous research in 2021. The results are clear. When we talk about pleasure, we can have both better and safer sex through increased condom uptake, better sexual health outcomes, and more knowledge on sexual choices. With policy, evidence, and practical guidance in place, there is a strong foundation laying the ground for the much-needed work to keep improving people's sexual health, experiences, relationships, and safety. And that's why we are so thrilled to see the results of this catalytic partnership today.
Thank you so much, Alexandra. So now I am going to introduce you to Rhiana Mills to actually present the data to us. Rhiana is a reproductive and sexual health researcher with a background in anthropology. She has particular expertise in the intersection of digital health and sexual and reproductive health. She's a Pleasure Fellow and has worked with the Pleasure Project to evaluate pleasure-positive SRH projects and understand the impact of pleasure on sexual and reproductive health. Rhiana, welcome. Thank you for joining us, and we look forward to your presentation.
Thank you so much, Elna, and thank you for having me. I'm just going to share my presentation. Hi, everyone. Yes, I'm going to talk about the research. So this research was born from the partnership between Amplify Change and the Pleasure Project, funded by the Case for Her, which you've heard a little bit about from Anne and from Alexandra. But essentially this all started when Amplify Change did a call out to all grantees asking if they wanted to implement some pleasure work through a pleasure top-up grant. And out of the grantees that applied, 8 were chosen to receive the grant. So this work really follows these grantees in their experiences of implementing a pleasure approach in their setting. And in a sense, and you've heard a little bit about this already, this paper sort of takes the next step. So we know that a pleasure approach can improve sex and reproductive health, and we've done the systematic review that you've heard a little bit about. And this paper sort of goes that next step and asks, okay, well, how do we implement a pleasure approach? What does a pleasure approach look like pragmatically? And you can see here in the photos on the right, this sort of pleasure implementation going on, and I'll tell you a bit more about that. So to get at this understanding of implementing pleasure, we spoke to the 8 grantee organisations who had implemented pleasure. We also spoke to those managing the grant process, so Amplify Change, and those providing technical support, so the Pleasure Project, to gain their perspective on sort of funding this sort of work across the globe. We collected data from written surveys that our pleasure implementers filled out at 6 and 12 months post receiving their pleasure top-up grant, and we carried out 3 focus group discussions with pleasure implementers, and then 1 with Amplify Change and the Pleasure Project as well. We qualitatively and thematically analysed the data to understand the implementers' experiences of implementing pleasure, and also to draw out some of those pragmatic best practices, which we also fed back to implementers in sort of a best practice co-creation session. So just to start, I just wanted to show you this map, which is going to just give you a sense of where this is going on. So we had pleasure implementers across Africa and in India as well, and they were implementing a pleasure approach across a wide range of groups. So we had pleasure implementers working with midwives, pregnant women, young people, sex workers, trans women, and healthcare workers as well. And this map also includes some of the sort of tangible pleasure outcomes that pleasure implementers told us about. So, for example, Women's Health and Equality Rights Association in Rwanda trained 120 facilitators from 8 community organisations to deliver a pleasure approach to young women and girls. And Transgender Equality Uganda trained 20 healthcare workers who work with trans women to deliver a pleasure approach. And of course, Ingrid and Beyonce are going to talk to you a little bit more about their work later on. But as you can see, there's lots of examples here, and this map is included in the paper, so you can have a proper look at it there. But this is just to give you a sense of sort of where this is all happening. But in terms of results, the results from our analysis, well, we report results on a couple of themes. So pleasure portals, barriers to pleasure, and pleasure mechanisms. So I'll talk you through those in the coming slides. So this idea of pleasure portals, the idea that pleasure sort of opens up opportunities for experiences and learning as well. And this sort of first emerged when pleasure implementers discussed how joyful group discussions and workshops around pleasure could be. So opening up this portal of enjoyment and joy. Pleasure implementers also spoke about how a pleasure approach provides an opportunity for training and also to practice communicating about sex and pleasure. And this increased people's self-confidence, particularly around communication and navigating sexual relationships. And this confidence around communication skills can be really important for people in discussing consent and navigating safer sex practices with partners. And so we see that pleasure is a portal to better sexual well-being too. And this echoes some of the other evidence on the link between communication skills and safer sex. But also beyond what we traditionally sort of mean by safer sex, a pleasure approach also sort of opened up opportunities for discussion of sort of wider sexual well-being topics. So we had people discussing how to maintain good genital health when masturbating, or dealing with premature ejaculation for young men. So it was a real wide-reaching in terms of sexual well-being. And besides those that participated in the pleasure approach, the facilitators too felt the benefits of a pleasure approach. So they gained confidence in talking openly about sex and pleasure. And this made them better facilitators. They began to facilitate pleasure approach with greater vulnerability and depth. And this in turn benefited the people they worked with, sort of by modelling this openness and the communication skills as well. But of course, implementers also experienced some barriers to a pleasure approach, and that included shame, sort of within themselves, within participants, and then sort of in wider context as well, which is not uncommon when it comes to sexual and reproductive health, as I'm sure many of you know. But I think particularly sometimes sexual and reproductive health topics can hide behind maybe more sanitized masks. So we get sort of like family planning rather than contraception, that sort of thing. But pleasure is very much about sex, sexuality, and enjoying yourself. And all of these can be highly stigmatized. But pleasure implementers also spoke about not assuming people will feel ashamed of sex and pleasure. Often there's an assumption that a pleasure approach will not work outside of certain groups that might traditionally be more accepting of talking about sex. But this work has sort of challenged that assumption, and we'll talk a little bit about that later when we talk about best practices. Gender norms and misogyny also played a role as a barrier to pleasure, as we see here with this pleasure implementer describing what is sometimes called the orgasm gap, where men are more likely to have pleasurable sex compared to women. And we see this also can be quite culturally ingrained. But equally, pleasure approach activities also revealed inherent gender norms, where girls were often quieter and shyer when discussing sex and pleasure, feeling more nervous to have their say. And some activities happened in separate groups of girls and boys or women and men to make this easier in certain contexts. But also pleasure implementers spoke about how pleasure approach activities were a space in which to unpack heteronormative sexual scripts and the effects of gender norms and misogyny on sex and pleasure. And this might be due to some of the identified pleasure mechanisms. So pleasure mechanisms are a way of describing why talking about pleasure might be helpful. Implementers told us that a pleasure approach tends to deal in the more granular. So rather than talking about sex as a big sort of opaque topic, group discussions were led towards talking about touches, desires, sensations, and experiences. So the sort of building blocks of sex, if you will. And focusing on these building blocks may allow for more empathy and less stigma. So an example of this is Young and Alive in Tanzania told us that in their context, homosexuality is highly stigmatized and in fact criminalized. And in this context, Young and Alive implementers told us a pleasure approach can be helpful in initiating discussions around diverse sexualities. As discussions of where people like to be touched, how they like to be touched, and who they like to be touched by are easier discussions to have. And these pleasure building blocks sort of lay the foundation for young people to appreciate diversity of sexualities, both in others and themselves. And there are other examples of how this granularity might work, but I think that's quite a nice one. Our second pleasure mechanism links back to our first pleasure portal. So people really enjoy talking about pleasure, meaning that they're engaged with the discussion, and as a result are more engaged in their sexual and reproductive health and well-being. And pleasure implementers also talked about how groups bonded well in these pleasure approach activities, and again that sort of boosts the engagement factor. So we've talked a little bit about experiences of implementing pleasure, but we also translated some of these experiences into some recommendations or sort of best practices. And we asked, so what does this all mean for implementing a pleasure approach? So I stole these beautiful designs from the best practice notes. They were designed by a designer called Manya Dar. And in this best practice note, we summarize the best practices that we report in the paper. And they cover 4 areas of sort of pragmatic recommendations. And those areas are sort of before you begin, so what to think about before you start implementing pleasure, using language and voice, facilitators and training, and then also spreading the word of pleasure far and wide. So best practice 1, we've sort of nodded to this already, but is to not make these assumptions about how open or closed people or groups will be to pleasure. An example here is that midwives in the DRC were trained to give a pleasure approach to pregnant women. And the pleasure implementer organisation told us that there were some hesitations around this. And it's often thought that sort of heterosexual people in sort of quote unquote conservative or religious contexts are out of reach for pleasure programmes. But this was not the case here. So, you know, both midwives and women participated and appreciated this approach. So basically, you can't guess who will or who won't accept pleasure as an approach. Best practice 2 is honour the pleasure work that's already happening. So pleasure work might be happening in a range of settings, but potentially under another name or through different channels. But if it is there, it's a great existing infrastructure, so to sort of layer additional pleasure work on top of. Language and voice, or sexy talk as we call it. This was so interesting to me. So how pleasure implementers sort of navigate language. So they told us that often language around pleasure can be inherently negative or sex negative in local languages. So implementers found ways around this. So they might have mixed languages, so used in one example bits of Swahili and bits of English to get around that. Or in another example, they verbalized emojis. So Where the aubergine or eggplant emoji is often used to refer to a penis via sort of emoji talk, this was verbalized as a neutral way to refer to penises in that context. Pleasure can also be introduced slowly using topics that feel sort of safer. So in this example on the screen, respectful maternity care was used as a vehicle to start introducing pleasure. And also there's often a lot of pushback on using a pleasure approach with young people, as there's a worry that it might encourage them to have sex. But amplifying the voices of young people who are enjoying and benefiting from a pleasure approach is one sort of antidote to that. So, yeah, facilitators and training. So for those facilitating pleasure work, it's important to recognise that this may be a new skill and that we all harbour some shame and discomfort around pleasure, and it can be a process to unlearn this, perhaps a lifelong process. So offering comprehensive and ongoing training and support to facilitators is important. But alongside this, facilitators sort of should have that capacity to be able to communicate positively and non-judgmentally about pleasure and sex. Of course, sort of alongside all the trainings and support that might go into that. As we mentioned previously, it is nice when facilitators can be vulnerable and open about their own experiences of pleasure, to sort of model that openness and those communication skills. Of course, the caveat here is that, you know, we speak about and open up about pleasure when we're comfortable doing so, and with no pressure to share when we're not ready. And yeah, so in some cases, facilitators who are the same age and gender as the group can help with more sort of fruitful, open discussions. And lastly, in the best practices, is document and evaluate, spread the word, which is what we hope to have done here. So evaluating and documenting your pleasure implementation helps to add to the evidence on the impact of a pleasure approach. And with more evidence, advocacy for a pleasure approach can be stronger. So this is our, I'm a bit behind, aren't I? There we go, that's the right slide. This is our paper. And our example of documenting and evaluating. So we're very excited it's been published. I haven't really spoken today about the case studies that you'll see on the screen, but they are included in the paper. They're super interesting and they sort of further illustrate what I've spoken about today. So please do go and check out the paper in the Sexual and Reproductive Health Matters journal. And if you have any thoughts and comments, yeah, please feel free to either ask a question or reach out. Yeah, that's all from me. Thank you. I think I'm handing back to you, Elna.
Thank you so much, Rhiana. Very, very interesting. I already have a lot of questions, but I will let us run through all of the speakers and then we will get back to questions in the end. But thank you for sharing that. And then I am going to introduce Katie to you. So Katie Northcott is the communications manager at Amplify Change and their focal point on pleasure. Katie joined Amplify Change in 2016 as a technical performance manager, overseeing the abortion rights and francophone grants portfolios, transitioning into the communications role in 2022. Katie presents the tips for their partners and the best practice, and then also introduces a very interesting panel. So thank you very much for joining us, Katie, and for your work at Amplify Change too. And we look forward to hearing from you and your panel.
Thank you so much. It's wonderful to speak about not just the research, but the partnership and the work that we are able to support through the partnership itself. So for a bit of background, Amplify Change is a multi-donor challenge fund. So this means that we hold open calls for proposals throughout the year to fund civil society organizations advocating for improved sexual and reproductive health and rights in their contexts across Africa, South Asia, and the Middle East. We have a specific focus on 5 key areas of SRHR, which are eliminating gender-based violence, including FGMC, sexual and gender-based violence, and child marriage, improving access to safe abortion choices, eliminating stigma and discrimination towards LGBTIQ and sex worker organization individuals, improving youth access to SRHR, including through comprehensive sexuality education, and improving access to sexual and reproductive health services for vulnerable and marginalized groups, such as persons with disabilities. So as a challenge fund, we are always looking to support organizations who are implementing innovative and effective approaches and solutions towards improving SRHR in their context across the globe. So for us, when we had the chance to run this pilot project with the Pleasure Project and the Case for Her, supporting a cohort of organizations who had received Amplify Change funding for their projects, but were interested in integrating a pleasure approach to that advocacy work, we thought it was an excellent opportunity. Not only would it allow Amplify Change to learn about the effectiveness of the pleasure approach and its impact on SRHR advocacy from a donor perspective and from the perspective of an organization who seeks to support some of the most innovative and effective means to improve SRHR, but it also allowed us to be able to contribute to that global evidence around SRHR and SRHR funding in particular, and the importance and position of pleasure within SRHR funding. So as a result of this early collaboration with the Pleasure Project and with the support with the Case for Her, we were one of the early endorsers and adopters of the pleasure principles as an organization. And as a result of this, we have integrated pleasure-inclusive approaches to sexual health within our funding guidelines. So this means that any organization who is interested in working to integrate pleasure approaches into one of the 5 key areas of SRHR that we support are welcomed and encouraged to apply to us for funding. And I don't have any key statistics, unfortunately, to share, but we have seen a steady increase in the organizations who are putting forward proposals that include pleasure-based approaches to SRHR advocacy, which is very exciting. For us, pleasure is a cross-cutting approach that complements our other key priority areas of sexual and reproductive health and rights that we seek to support through our funding. So we were very excited about and thrilled with the work and the collaboration with the Pleasure Project and the Case for Her and the 8 organizations that were supported through this project. And the results of the research speak for themselves in terms of the wonderful impact and outcomes that we've seen. But I'm not going to be here to just talk about those outcomes. I'd like to introduce 2 representatives from 2 organizations who are working on the ground every day to advocate for improved sexual and reproductive health and rights in their contexts. And these organizations were also participants in this Pleasure Grants scheme. And they're here to share their perspectives and reflections on pleasure-inclusive SRHR advocacy. So I'd first like to introduce Beyonce Karungi, who is the Executive Director of Trans Equality Uganda, and who is a trans rights and sex worker rights activist. I'd also like to introduce Ingrid Uwase, who is the Monitoring and Evaluation Lead for Women's Health and Equal Rights Association Rwanda, and a women's and gender equality activist. Welcome to both of you, and thank you so much for joining us here today. So I'd like to start our conversation just by allowing both of you a bit of time to introduce your organization and the work that you do on improving SRHR in your context, being brief and concise, considering that we need to get through the other questions. But Ingrid, if you'd like to start, and then Beyonce can tell us about their work afterwards.
Thank you so much, Katie. As you said, my name is Ingrid, and I work for Women's Health and Equal Rights Association Rwanda. And is based in Rwanda in the south mostly. That's where we started our work. And then we work with women and girls to promote equality and also to ensure that we provide services and information that can help them to make choices, their body choices, and to also make sure that we disseminate information that can help them to understand, when it comes to abortion, the legal framework of the Rwandan context, and to make sure that we fight stigma and different myths and taboo that surrounds SRHR. Thank you.
Thank you, Beyonce. You're on mute.
Be on mute. Oh, Thank you so much, Katie. Once again, I'm Beyonce Karungi. I work with Transgender Equality Uganda, but now currently I'm in the US because I think most of you must have heard about the law that was introduced in Uganda. Because of my safety and being a lead activist, I could not be there. That's why I flee, for part-time, and I was outed. So for the time being, I'm here as the situation comes down. Basically, what we do in Uganda, we do advocacy around trans issues because, people in Africa, I really fought a lot, to raise awareness in Uganda because people in Africa, when we talk about key populations, people only know in Africa, mostly they talk about MSM and female sex workers and forgetting trans people, trans people are invisible. So that's why I really came out strongly to advocate for our rights. And mostly what we do also, like mostly I think the number one smart area comes is health. We do around sexual reproductive health and rights, inclusion of, providing gender affirming healthcare services, HIV prevention, sexual health, IEC materials, raising awareness, training health workers, engaging the government and key stakeholders like the police in case of the arrest, and local leaders because what we want to do is trans women enjoying their sexual right and health, enjoying their sexual reproductive health without any interference and stigma and discrimination, referrals and linkages to health providers. For example, we only used to work like in Kampala, but now with the funding from Amplify Change, it helped us to move further, like in the rural areas. We like trained health workers in the rural areas to get to understand because we had issues like things like forced annual examinations, and for us, those are human rights violations, regardless of anybody. We, like in Uganda, for us, we say that anybody, regardless of your sexual orientation, gender identity, every Ugandan has a right to access to healthcare services. Thank you so much. And hey, one other thing I'm forgetting, also we provide security and emergency support because the trans people can't keep into the closet. When people are attacked, we provide those emergency support and healthcare. Thank you.
Thank you. Thank you both. So how did you integrate pleasure into the work that your organizations were doing through this partnership and then potentially since then? And what was that experience like integrating pleasure into your SRHR work? Maybe Ingrid, we'll start with you again.
Thank you. The way we integrated Pleasure Project in our SRHR work, we started with some of the groundwork that was being done with the girls that we were working with, the girls who were out of school. So what we were doing, it was mostly to use our usual way of communicating with them, which was through workshops and also through trainings. And also we engaged in with other organizations that are also working in SRHR, that they can also try to share the information. We also we did those through the workshops that we conducted with them. And then we also tried, the way we also integrated the work, it was through making information available and also clear, like actual language. We had to make sure that our staff are really well trained and that people who can actually talk about pleasure or sex positivity without shyness or like misinformation. And because we were trying to demystify a lot of things around it, those are one of the ways that we integrated in the pleasure projects.
Thank you so much, Katie. For us, like, coming back to Uganda and, the hostile environment, what we had to do, we had to sit. When we saw this project coming, before even what we applied, we said, what do we need to do given this environment? We had to consult from the Ministry of Health and the Ugandan Commission that how this project is coming, but really we want support from you. So they told us to go ahead and apply. So we applied, and then one of the things through them, we had to bring these young, we told them to link us up to young people who are working on the sexual reproductive health. But then it was hard for us, because when people hear about trans people, they think about homosexuality, being recruited and stuff like that. It became so hard. But one of the things we learning the lessons we learned is like, I think working with the key stakeholders like Ministry of Health helped us like moving forward. We developed IEC materials, like things like t-shirts, the printing of the papers and stickers that we put. We gave people information, like people to put on their laptops in offices and drop-in centers and other key populations. This is how we got to integrate into the pressure project. Providing information through IEC materials is one of the things that helped us, navigate and go, into dedicating to work with, other partnerships.
Great. So in terms of the implementing pleasure as part of your work, what surprised you the most in terms of the outcomes or impact that you saw from the pleasure work that you implemented? Ingrid, go ahead.
Yeah, I think it was even one of the findings that Rhiana shared earlier. It's like, don't assume. For example, for us, we realized that we were anticipating people being shy. And when we're conducting when we opened the topics, like people became easier to talk with. Like there was no shyness that as we were expecting. It was one of those things that really surprised us, I would say.
Thank you, Kate. Also, one of the things that came up, the learning, because for me also, it is another thing again that came to me, because usually we talk about sex and sexuality. It was hard, but then like people were shying, but these things came up, people were open, like for example, our members didn't know the things like personal hygiene came up, like people were engaging in sex work, things like people say we needed to clean ourselves. It's one of the things that we didn't know about, pleasure, project. How did people didn't know even how, like, when you're providing a service to your client, people didn't know these things. How do you provide a service? Like, for example, how do you satisfy a client if you're a trans woman? There is competition within trans sex workers and female sex workers. So these things came, and like, you're not really competing. Like, how, pleasure, what does it mean? Some, things that came up. Some clients, needed like blowjobs, and which, female sex workers never give. These are the kind of things that land. People were shying away. So these are the things that people talked about. And also things that came up, it was another thing like there was no shame. Things were like self-stigma, talking about things like, oh my God, going to health service providers and asking for lubes and condoms. It was really hard, because this is an example that I gave by myself also. When we went, I wanted to give a try, because the government was funding lubes and condoms through Ministry of Health, and through like Global Fund gave money through Ministry of Health. But then they provided these lubes and condoms into service providers who are religious leaders, for example. For me, as an activist, I went there with a young gay man. I wanted to see like how this attitude of a health worker would say. Then I didn't say anything, because I said, you say you are a gay man, because he was afraid to say this. But I said, say it, I'm here. If anything, because I'd already told my colleagues about where we're going. If anything happens, we should come there. So then one of the things, it was really hard, because these people said, oh no, we can't give you this, because religion does not allow. But then one of the things, because one of the pressure, you can't have sex without lube. One of the things, do you know what that means? And so this gay man, being a young person, you've denied him a service, really, that he's being stigmatized. How does he feel? Those are the things that came back to us. Again, I learned. So this memory came back. I'm like, oh, these are the things. And also, I think during this conversation, the other things that came up in the group discussions as we kept discussing is like mental health. it also helped, like, people coming up, it was a group discussion, it was, mental health, people talking about sex and sexuality. So one of the things that came up, the outcome, we found that even people ended up, founding a group, a dancing group. For me, that was an achievement because I wanted trans women to speak themselves, one of the things. So, I mean, these are the important outcomes of the Pleasure Project, after the discussions that went on, through discussing sex and sexuality, pleasure. So these are the major outcomes that came out.
It's great to hear that, across two sort of, projects working on two different topics with two different or a few different types of people, that this idea of, pleasure as a way to gain confidence or to, move away from feeling shame about sexuality is, sort of this result that you see across a lot of different projects and communities. So just one final question to wrap up. What recommendations would you have to anyone who is curious about integrating pleasure into their sexual and reproductive health and rights work? Ingrid, please.
Yeah, I think I have 2 points. One is to make sure that the context that you are working in, you understand it very well, especially like the cultural context. For example, in our work that we were doing, it was so easy to give them the information or to even open up the whole discussion if we demystify a few things from our culture. Like if there is examples that you have in your culture that you know for sure it are not real, and it's around like sexual pleasure, please use them, and it will easily open up the whole conversation, and it can easily help in even curate the whole curriculum or the content that you will use teaching. And then another thing will be to train the staff that will give the information. If the staff is shy, the whole group will be shy. Just make sure like the people who are giving the information are really not shy. They know what they're talking about. You have all the equipment that you might need. Like, for example, if you want to use like a dildo, please do have those dildo that they can even see them, to also have like a feel, so that it's something that everyone feels comfortable with. So those are the 2 recommendations that I would share.
Thank you so much, Katie and Ingrid. To add on what Ingrid says, also the other thing is empowerment. One of the recommendations that I will give, because one of the key things that came out was empowerment. For example, when these girls came out after talking about this, they felt that they were empowered. So they even said, we want to form a group, of dancing that will help us to do advocacy. Those are the things, fighting stigma through dancing. I didn't know this, that advocacy, dancing can do advocacy. I didn't know. It came out of this Pleasure Project. So many things came out. That was empowerment. Number 2, one of the things, like Ingrid says, we should not shy away. We should not, even if culture, religion say things, but sex is a natural thing. We should not shy away from talking about these things. These things are real. For example, when it comes to trans people in the hostile environment, when we were talking about these things, people would ask many questions. But are you really sexually active? Which kind of sex do you have? Those kind of things. We told them that we are also human, like we also have feelings like anybody else. So, I mean, for me, like Ingrid says, we should not be shy away from these things. These things happen. Sex is real. HIV is real. These are the things that we should talk about when we talk about, we should empower people. Let people be themselves, let people do what they want to do. Provide services, those are the things. Yeah, I mean, for me, those are the recommendations that I will give. Always, we should not shy away. Whether we, that we should live out with the African values of culture, religion. If we stay in these things, then we will always stay stagnant. Nothing will come out. Things people will always see, like people will shy away. Like if someone, like a young girl is pregnant, she will fear to tell the parent. You know why? Because they are shying away. The same thing. Like if a trans woman has been raped, she will shy away because, oh my God, she's afraid to say. These are the kind of things we're talking about. Let's stop shyness and, implement and do the work. And for us, that the Pleasure Project really helped us to know many things that we didn't know. Even I myself didn't know about pleasure, I didn't know about sexuality. I got to learn in the focus group discussions where these people were saying things. It helped me. Also, I learned. It was like a capacity building. So we recommend the donors who funded Pleasure Project to keep funding so that we expound and bring more people on board, like health workers, people, the perpetrators who violate human rights of trans women, to come on board and learn more. Because, these things are sexuality is very interesting. When the people come to learn, they get interested. Thank you so much.
Thank you both so much. We had such wonderful I'm not sure if you saw the little emojis, of reactions coming from the audience when you both were speaking about your work. But it's been such a pleasure to hear you speak about the work and your passion for pleasure, I'll say. But thank you both so much. And I'll hand back to Elna.
Oh, thank you. I am tearful from all of these emojis. I've run probably 30 webinars for WAS, and I've never seen this many emojis, just showing how we honor the people who really do the work on a grassroots level, and who live the life both of the stigma and discrimination. It is just unthinkable to most of us to have to be in a country other than your own, just because in your own country you're not welcome there, and really in danger based on your gender identity, as is the case for Beyonce. We have a lot to be grateful for, but we have a lot of work to be done to make sure that all people of all genders and orientations are safe all over the world. So thank you for that panel discussion. I am going to bring on everybody now so that we can start the discussion with the bigger panel. Thank you for hosting that one, Katie. And thank you. I see here is Rhiana and Alexandra. Beyonce is back. And you just have to switch on your camera again. There you go. Okay, cool. So, I have a lot of questions from my side. And, being an African myself and from the religious community myself, I often see this massive pushback. I had a friend asking me the other day to sign. She doesn't know what I do for a living. She's just a mom at school with me. And she asks me to sign a petition, anti-CSE petition. So for those of you, CSE is comprehensive sexuality education, because she says, because you know what? They want to teach children at 4 to masturbate. And I'm like, oh my goodness, I've got multiple degrees in sexual health and no one has ever taught me how to masturbate. It's not something you have to teach children. But of course, we know that comprehensive sexuality education has a massive positive impact on various outcomes. And now we get the data to show that if you make it pleasure-based, it even more so. And it was so good to hear of these practical examples. Ingrid, I have a question for you. You said that if there is shyness with the facilitators, they transfer that, and we see that also in our schools in South Africa. The teachers are extremely uncomfortable for the in-school sexuality education. The out-of-school sexuality education in our context often happens within church groups or other NGOs, and the facilitators are extremely shy. So how did you guys manage to overcome that in your trainings?
I think when again, because if you understand the cultural context, you start from that. You easily just demystify a few things a little bit, and then it becomes easier for them to even because there are a few things that came up during the process. It was this lady who told us if they are wet during sex, it reduces their chances of contracting STDs. So even though they're talking about having pleasure, they're not talking about having pleasure in the sense of just for them to enjoy, but just to protect themselves. You see, so you start from there. You start from what's there, and then you build on that low-key. And also you have to make sure that the space is comfortable for those people to talk, and you also give a few examples yourself. Like you even teaching, be comfortable and then say the words without trying. Like I saw people who say the language sometimes that the Swahili mix it with English. Kinyarwanda is like the words are very strong. You just try to say them the way they are and don't shy away.
Good. Thank you very much. Very interesting. And Beyonce, how did you manage to overcome that shyness in your programs?
Sorry, can you say that again, please, Dr. Elena?
Ingrid said that the people were shy. They found that the facilitators, the trainers that you guys trained or that got trained, even the trainers can sometimes be shy. And then if they are uncomfortable with the information, they portray it in an uncomfortable manner.
Oh, okay. So for us, already people who trained were already empowered because we had to sit down. We had to sit down. For example, me, I had to sit down with the people who are going to talk about these things. I'm like, you don't, please, if you feel shy, let me do it myself. If you feel you can't do it, let me do it myself. Because for me, I'm already empowered. You know, I've been speaking, I speak about the things in forums, so it is okay. But then in the circumstance of the places that sometimes I was busy, I was in the meetings with the Minister of Health, Uganda's Commission, I was in other groups. I had to empower them and tell them, please, if you feel like you can't say this, please let me know. I can stand by your side. So yeah, we kept training them and talking to them until people felt like they are confident to talk about these things. And then I said, if you're in this thing and you feel you can't talk about this, make a joke, you know, make a joke, make sure that people, you know, in this way, make a joke and, you know, people get to, you know, because sometimes when you make, or get an energizer, you know, in the form of sexuality so that people get to know. For example, you dance the way you make, like you move your body, you know. So these are the kind of, you know, this is how we really came out to, you know, empowering people and, you know, training people on how to speak about these issues.
Just be real and yourself, because sex is so natural and people try
Yes.
to make it unnatural and or uncomfortable about it.
Oh, yeah.
So thank you for that, Beyonce. I would like to open to the panel. You know, what we see at WAS and what we try to fight very diligently is the backlash against comprehensive sexuality education in and out of school. And I was wondering if some of you from the panel, now, if you add pleasure to comprehensive sexuality education, you get 98% of people running out of the room if they don't understand what it's about, you know, because somehow people think it's about teaching children to masturbate, as I said earlier. So how do we really diligently fight this backlash? I know the evidence that you guys are producing. And I mean, that's something that we at WAS strongly support, is that we do policy making based on evidence. So it is fantastic that you've done that work. But what other ideas can you guys throw around? There are so many people here attending this webinar who are interested in bringing pleasure into their work, into their activism, into their clinical services. But the backlash against it is massive. How do you suggest we address this backlash? Anne, you want to go first?
Go for it. Yeah, this is such a common conversation. And I think one of the things, I think the word pleasure, people even run away from that. But that's often you have to like reassure them because they might imagine in their mind what that means. But it doesn't mean that you have to have an explicit conversation with somebody. It doesn't mean they have to disclose their own sex life or their own details if they don't want to. And we've actually, in the pleasure principles, there's a whole pleasure principle. There's 7 of them, and they're really fun to read. They're not dry. One of them is called Talk Sexy. And you heard Rhiana talking about what we learned about how to actually have the conversations. And in that, there's loads of tips about how you might even start that conversation, how you would calm people down if they're getting worried about what you're going to talk about with young people, for example. And I think also you can reassure people that, you know, you're going to talk in different ways to different groups. You know, people understand what's needed in their own context and in their own communities. And I think you can, you know, as Ingrid and Beyonce have shown, you relate it to what's needed in that community. I might talk about sexual well-being, for example, if somebody feels a bit nervous about pleasure, and then kind of build up to the conversation. With young people, I'll say it's really important that young people need to understand their choices and their body autonomy. And with younger people, that might be understanding that if somebody wants to, squeeze their cheeks or give them a kiss on the cheek, they can say that that's not what they want, right? So you can, really build in conversations in a way that's very appropriate, that's very context appropriate, that's very age appropriate. And we've got lots of tips about how to do that in the pleasure principles in Talk Sexy.
Thank you, Anne. It reminds me that what we see is so often people who push against the education that's provided by the school go and they make their own little curriculum, which we are very worried about, because people like you and, UNESCO have done a lot of work on actually putting out proper guidelines that are age appropriate, that's well researched, and people should be referring to those primarily. I see that Elna has very kindly shared the pleasure principles with people here in the chat. Please go and look at that. We'll also share it with you when we share the links to this.
And just to add to that, I mean, I think a really critical thing, which I mentioned, is that what we know now from the evidence and what's been published with the World Health Organization is that if we don't talk about pleasure, if we don't talk about the choices that people can make, then our education isn't as effective. And that's a really critical, important thing. So by missing it, if you feel awkward and you decide you can't talk about this, then you're actually making your services less effective. You're not serving the communities as effectively as you should be in your responsibilities. And just one last thing, another piece of work we've done is to look at what does it mean when you say it's not in my culture. And we worked with the Africa Regional Office of the International Planned Parenthood Federation on doing a big project called Treasure Your Pleasure for young people across Africa that they found really appealing, and they engaged with, and a huge amount, it was 9 million young people. One of the things we looked at is pre-colonial narratives of sexuality and sex education and practices within communities that continue, that are actually about honoring pleasure, that are actually faith-based but are not stigmatizing about pleasure. That actually you can see when you look at history that a lot of the stigma and shame has come from British Christian colonial narratives overlaid onto existing positive, sex positive narratives of sexuality. So I think you can also gently talk to people about what was here before, what else exists. Talk about poetry, talk about literature. You can have these conversations in a way that also can be quite gentle and creative. Thank you.
Excellent. Thank you. Rhiana, you did the work. So do you maybe have a comment on that?
Yeah, I'll just quickly chip in just to speak to Anne's point about that idea of using safer sort of topics as a vehicle to talk about pleasure. And the DRC, the midwives told us, well, the organization that worked with the midwives told us that they spoke a lot about respectful maternity care and the respect and the choices that you'd want to have when you're giving birth can be translated to the respect and the choices that you'd like to have when conceiving the child. So they used it as sort of a vehicle to talk about pleasure. And I really liked what Anne said about creative ways to make pleasure feel accessible for everyone. And I think people are doing that. I think people are very good at working within their own contexts and knowing sort of how to do that.
Thank you, Rhiana. Alexandra, do you want to add to this?
Yes, I really appreciate what Anne and Rhiana has touched upon, but I think what's also extremely integral is funding to catalyze and enable this incredible work that all of the various panelists have been discussing today. And I think it's also a huge opportunity for funders to be bold and advocate openly, publicly, the underserved opportunity of funding and investing in these efforts of pleasure, sexual health, positive pleasure-based approaches in practice and in evidence. So I would, like to call on various funders who are, funding or are considering funding pleasure to be more open and discuss and destigmatize pleasure, because it's really just one of the most intersectional catalytic opportunities of reaching various goals of like Sustainable Development Goal 5, gender equality. So I would definitely encourage more to talk openly about it, because it's so needed and there's so much good work done in this field that needs to be kept on, that needs to keep on and grow. So that's what I would add.
Perfect. As if someone wrote that piece for you. It was so well said, but that is exactly what we want, to get more funders on board, let go of the old stuff that we know is not working anymore, and push forward with what we now know works. Katie?
Oh, I don't know if I have much to add. I think everyone has really covered a lot of the bases. So one of the areas that Amplify Change does fund is comprehensive sexuality education and advocacy for quality comprehensive sexuality education and life skills education. And what we've seen is that, I think basically echoing what everyone has said, is that it's about meeting people where they're at and integrating step by step sort of those more pleasure inclusive aspects to sexuality education that allows for that opening up perhaps for further exploration of how education can be more inclusive of pleasure. So I've actually posted in the chat now a blog that was written by another organization that actually participated in this partnership, who worked with faith-based schools on implementing a more pleasure-inclusive comprehensive sexuality education curriculum. And I think it just goes to show that, I think, just echoing what everyone said, it's about using the cultural context as a gateway and as a starting point. It's about finding those ways to introduce the topics in a bit more of a softer approach, perhaps, than sort of going in full force with pleasure with a capital P. And I think for us as a donor, it's about listening to the organizations that we fund, because they're the real experts on what works and on what approaches are going to be the most effective. So the more that we can learn from organizations like Women's Health and Equal Rights Association and Trans Equality Uganda about what is actually working to make that change, the better that we can be at making sure that we're investing funding into the most effective ways to make change. But yeah, essentially, I just agree with everything that's been said.
Thank you so much, Katie. So I spent some time at a conference in Dubai towards the end of last year, and I had to talk about how to bring sexual health services into cultural diversity. And there you are so acutely aware of what's going on. In South Africa, I pretty much live a life where I'm never exposed to gender inequality as a person, but there you see it. It's a very male dominant world. The women are all covered, and broaching subjects like masturbation, for instance, is very difficult. But what we try and do at the World Association for Sexual Health is we say any information that is shared needs to be evidence-based and scientific. And there's a difference between the two, actually. You've created the evidence base for what we thought would, there is a lot of science around pleasure, not enough yet. We still need to know more, but we need to generate evidence. And it is amazing to see. And you've been part of the publication of the Sexual Pleasure Declaration, to see how pleasure research has just exploded since the publication of that declaration. More and more researchers globally are interested in pleasure in general. And pleasure is political. It's not only protective. It brings about, as you said, Katie, I believe actually sexual health is a vehicle to basically every one of the Sustainable Development Goals. Without proper sexual health in a country, like what Beyonce is experiencing in her country, we cannot talk about reaching those goals. So back to what WAS believes information should be like. evidence-based and scientific, rights-based, and then experience-informed. So that's why we have Ingrid and Beyonce here, the people who do the research, the people who do the funding, the people who do the actual advocacy. Those experiences are extremely important, because the few university professors who are actually sexologists will not be doing this. It will be people on the ground that's doing it, and we need to learn from the people on the ground how it should be done. And it's different in Uganda and in Rwanda, for instance, and all over the world. And then for healthcare providers, because I'm a medical doctor, I see patients all the time, and I work in a religious context. And well, I'm not aware of one religion that actually does not champion pleasure. Religions champions pleasure, actually. Not to say, oh, go out and find as much pleasure as you want, primarily, but it's used in a way that causes inequalities, as we are very well aware. But it does not sit poorly within religious context if you are culturally sensitive, because that's the last part of that definition of ours of how information must be, and that is culturally sensitive. And what I find in my practice is that I just often have to say, for instance, oh, but masturbation is sin. And then what we have is we have the evidence. We have the science. We know that it is not harmful. So being the conduit for that person, because if you're sitting on a high chair up here and saying, you stupid, the way that you believe is wrong, what are we doing? Recolonizing people, actually. So instead, being the conduit, meeting the people exactly where they are in a respectful manner, but with the science and the evidence, so, and then the experience, so that we can convey this information in a culturally sensitive way, other than, dumping our hoi polloi knowledge from our fancy offices in the global north onto people. So, well, yes, just from our perspective at WAS, we are so in line with, grateful for championing the work that you do. It's exactly what we feel there must be much, much more of around the globe. So, any comments to that? Or other questions for other panelists? I'll open up the floor for you guys if you want to jump in, yeah?
I mean, I was just going to agree with you, really. It's been great to see the trajectory from the WAS Pleasure Declaration, which gave more credibility to pleasure and talked about it in the importance of sexual rights as well. And then the evidence with the World Health Organization and the UN Special Program on Human Reproduction, and then how that's been translated into the pleasure principles, which now over 35 organizations have endorsed. So please do look at that and endorse them. All the organizations here of these esteemed organizations have. So it's a great group that you'd be joining. But I think really, as you say, most importantly, what's important for us is now seeing this make a difference in real life. And actually the practical implementation is exactly so fascinating to have learnt about, and the work that Beyonce and Ingrid's organizations, but also the other 6, in terms of how they actually implement it in such different contexts for such different groups. And so do have a look at the best practice note if you're thinking of integrating pleasure into your work as well, into your practice with your communities.
Thanks, Anne. We will definitely be sharing all of these wonderful resources with you in an email afterwards. All of the links will be there. I know that there are it's probably been about 100 links shared already. So we'll make sure that we email it out to everyone that has subscribed to this webinar. I would actually, before I run closing comments, we are working on a project on out of school sexuality education, a big project coming up within WAS now, and some other key partners. And porn seems to be the big place where people have their out of school sexuality education. And most, if you could control porn to actually be educational, that could be great, but you can't. And most of it is just uploaded by itself. And I'm just wondering about your comments on, how can we how can we, what do we do with porn and pleasure and out of school sexuality education? Beyonce, I see that you've got your hand raised there. The mute just popped on again.
Okay. Am I muted now?
Now you're good. We can hear you.
Okay. Thank you so much, Dr. Elna. One of the things that before we close up is a recommendation that goes to donors. Please, Katie, please keep funding these projects because we've seen a lot of change and attitude change towards trans women now in Uganda since Amplify Change came on board. People now know, the local leaders, we had issues. We were being evicted every day. Like we kept moving away from offices and everything. But now, since we had these trainings, it has really helped. People have come to learn. So please keep funding because we trained people. We had GSD trainings on people getting to learn the LGBTI acronyms because people don't know the things. When we talk about LGBT, what people think about is homosexuality. There's nothing else. So you helped us. Keep funding us. Let's continue doing advocacy work. Thank you so much.
Thank you, Beyonce. So the porn conversation, there's a link shared, a great website, great resource there. But I'm just wondering if you guys or if you have any connections, or is this something, because it's something that we need to explore in this new project. That's why it's top of mind for me now to see if we, how can we incorporate that as well. Yes, Anne.
I mean, I could talk about this for hours, but I won't. I've been banging on for that's the wrong word to choose, but I've been going on about this for 2 decades about how more and more people porn is becoming sex education, has become sex education. And the public health world has been avoiding discussing that or avoiding engaging. But now we're seeing that this is leading to quite harmful behaviors and norms and myths. And actually rather than thinking you can censor it, which you can't, we need to talk to people about how it's not real life, and there's lots of different types of porn as well. There's not just, one type, but there's mega platforms which provide free content. But there is also some really responsible, ethical feminist porn makers who actually are educational, and we've worked with a few of them. There's one called Sex School Hub that's endorsed the pleasure principles that actually do create sex education, and they're brilliant at it because they are performers and they're able to actually show how to use condoms in a sexy way, for example. And we're also doing some research in the UK about how if you actually see more explicit but responsible films, that actually leads to less sexually transmitted infections. So I think there's a lot of work to be done, but there are starting to be some people who are less scared of that. And, I think it's a huge gap in the sexual health world to even not have the porn conversation is a massive mistake.
Yes, because you see, in highly religious communities, people still consume porn. Absolutely. And then because you don't talk about sex at all, the porn is the only education that there is. So it's also important to uneducate the nonsense that gets conveyed in unrealistic porn and to open up the conversation. Just talk about it, talk about it, talk about it, talk about it. And I was at the African Sexual Health and Rights Conference in Nairobi a few years ago now already, and they said to us, don't you come here to us with your pleasure things. Or we were advised there, because there are serious things in Africa, FGM and, child marriage and really serious things. What did everyone want to hear about? Pleasure. It is a great way to get people's attention, and not in a frivolous way. I mean, yes, there's also a lot of pleasure in pleasure, and there should be, but it is about people's right to pleasure, and also their right to comprehensive information about sexuality. And I think we are moving into an era where it becomes unethical to share information sexual health information that's not pleasure-based, because we now have the evidence that the pleasure plays such an important role. The flat negative messaging has been shown to be harmful and or at least not beneficial. I'm sure you can talk about that a lot also, Anne. That's your life's work, and the other organizations can also talk about that. So I think we can wrap it up. We can have a last comment from everybody. Rhiana, I've got you at the top of my screen, so I will give you just for a last 30 to 60 seconds of a wrap up, please.
Gosh, yeah. Well, thank you for having me. Thank you for listening to this research. I think it's really important. I can see lots of people in the comments sort of asking about how to implement pleasure in their context. So I'm hoping some of the tools that we shared are helpful, and do check out the paper. There's lots of information in there about implementation and how to do that. Yeah, I'm just so pleased to see everyone's engagement with this.
Thank you, Rhiana. So linking on to what Rhiana said, Anne, can we have like a workshop webinar where people can actually log on, where we can train them? Or can we not do this in a webinar? Can we not do like 2 hours and now you trained? How long do we need to train people in this?
How long have you got? We could do a range of different length webinars, but I think it would be great to do something about the pleasure principles and how to actually implement the evidence, including this evidence. What we've been with, just evidence is so important when you're trailblazing a new area, and really learning from people who are now the experts in how to actually implement pleasure-based sexual health. So I think we could have a webinar about the pleasure principles, but I was just going to say, please do look on our website and endorse the pleasure principles. You then get access to a whole community of practice of people who are implementing pleasure-based sexual health. And it's a very varied group from, WAS is in there, the Case for Her is in there, but also International Planned Parenthood Federation, the biggest provider of sexual and reproductive health services globally, but also smaller youth-based and community groups. So we exchange on what works and what hasn't worked, like this conversation, and we learn from each other and we support each other, because sometimes it can be challenging to have these conversations in our professional and personal life. So we support each other in a safe space to have those conversations. And we have a training toolkit that we tested and launched with that community of practice as well. So please do join us on the journey. And thank you very much for having us. This has been great, and great to see so many people here.
Thank you, Dr. Elna. I just want to thank the organizers of this webinar. I think let's continue having these conversations, despite the fact that sometimes people don't want to hear the things. I think, Dr. Elna, in the African context, people never want to hear about the things, but let's keep pushing. 30 years ago, people used to do advocacy. Like here in America, I'm seeing today's February is the Black History Month. They fought for their rights. They fought and fought and fought until they got there. So now we should also, like in this movement, let's also keep pushing and pushing and pushing and pushing, and never give up. Rhiana, everybody in this fight, Alexandra, never give up. Let's continue until we get there. Thank you. And then also, please, Katie, please keep funding our advocacy work. We want to see our work moving. Thank you so much.
Thank you, Beyonce. You got everyone inspired here. Katie?
Yes, I just want to say thank you so much for giving us this space to be able to share this amazing research and this amazing partnership. I think as Amplify Change, we've learned so much, and we're so pleased and proud to be able to continue funding organizations implementing pleasure-based approaches to sexual and reproductive health and rights advocacy. And we're a challenge fund, and so I would encourage any organizations who are on the call today to keep an eye on our website and our social media for upcoming opportunities for funding. If you are inspired and interested in integrating pleasure into your work, we're happy to receive applications from you. And of course, check out the Pleasure Project for website for resources to help you, think through what that work could look like. But thank you so much for having us, and a special big thank you to Beyonce and Ingrid for sharing your experiences as well.
Alexandra.
Yes, I think I usually end, with a call to action, but I think it's pretty prevalent that there is a lot of action, like in in this, like just in this conversation, all the incredible work that all of you are doing. I encourage all attendees to just, endorse the pleasure principles, go on to Amplify Change. I think both of these organizations has streamlined and lowered the bar to getting involved and taking action in, embracing, promoting, and accelerating pleasure. So I really just encourage you to use resources that will be shared. And I am, speaking on the behalf of the case, where we're grateful to be able to support these incredible organizations and all the work that you do. It's so integral, so critical. So thank you so much. And thank you, boss, for having this convening and bringing it all together. I think it's been highly appreciated, especially on our part.
Thank you so much, Katie. Sorry, now Alexandra, I call you Katie. Excuse me. No, and thank you to the Case for Her again, Amplify Change, the Pleasure Project for what you do, and then also the community-based projects. That is what our work at WAS is about, to champion the work that you do. As we navigate these critical issues, WAS beckons for your support. While we possess the experience and the expertise to effect change, we need allies to stand with us. I invite you to be inspired and mobilized by this webinar and to join us in our wave so that we can bring sexual health and rights for all. Thank you again to all of our speakers and our panelists. Thank you to our WAS team for doing all the work in the background, Renee and Michelle and Lisa. And I want to encourage you to become a member of WAS. And that's one way that you can join in this wave. By providing funding for our projects is another way that you can become part of this wave. And please follow us on our social media networks, and also all of these other links that will be shared with you. As I said, it will all get out into an email, so you will have a lot of work after this. Thank you again to everybody. It was wonderful to have you here. Please stay around. We are going to play the video of the pleasure principles again now as we exit this webinar. So thank you so much, everybody. Goodbye.